Well, there's been a lot of talk lately about doctors and how much money they make and all this talk about the health care reform. Let me be clear. I want doctors to make money. Frankly, I want them to make a lot of money. They don't have to make as much as Oprah. She made $275 million last year. Or George Lucas, who made $170 million. Or Steven Spielberg, who made $150 million. Heck, both Tiger Woods and Madonna made $110 million last year. You know, the average doctor pay is less than what members of Congress make. And specialists average an amount that's not much better. And that's before you factor in all the free food and the travel and the outright graft that some members of Congress will be able to add to the total. Look, I don't begrudge congressional salaries, but I sure as heck don't think that what they do is as hard as brain surgery or doing a heart transplant. When I was a kid, it was assumed that the valedictorian would probably go to med school, because being a doctor was pretty much for the best and the brightest, and we assumed they'd make the best money because they were smart, and they were going to have to be in school about 4 times longer than the rest of us just to become a doctor. Then they'd be on call 24 hours a day and have to get called out of church and their kids' ball games to hurry to the hospital to take care of people who got banged up in a car wreck or had a stroke. No, you see, I want my doctor to make good money. I want him or her to be the smartest kid in his class, not average. I want my doctor to enjoy being a doctor, and I don't want him coming into the operating room worrying about paying the rent, but rather thinking of how to keep me healthy enough so I can pay my own rent. If we keep talking about limiting doctor salaries, we might get people who really aren't that good, but they were willing to do the job at a discount. Look, I don't care that Oprah makes $275 million last year, if Kobe Bryant brought down $45 million, but I'll tell you, if a member of my family has a brain tumor, I don't want Oprah or Kobe doing the operation. I want the best neurosurgeon I can find, and I'm not going to be looking for the low bidder or seeing if there's a coupon in the paper for 10% off the cost. I want somebody who's worked really hard to know what he's doing and does it well. And if he's really, really good at it, he'll still only make about a penny for each dollar that Oprah makes. If one of the results of government fixing health care is to encourage the smart people to do what Oprah does and the dumb people to become doctors, then thanks, but no thanks. I need a good doctor a lot more than I need Oprah, and I want my doctor to make a lot of money.